The EcoWash project we designed on the back of a previous project that we implemented, which was the iShine project. iShine was trying to use WASH as a way of improving educational outcomes in schools by trying to encourage attendance.
Open defecation remains a widespread and pervasive practice in the two project districts. And this has far-reaching consequences, negative consequences, that affect the health and well-being of its citizenry.
EcoWash, which we built based on the lessons learned from iShine, is trying to look more holistically at WASH at various levels, the community level or the household level as we call it, which relies on the community-led total sanitation approach, shortened as CLTS.
CLTS is a participatory tool that is basically used to cause communities to reflect over their sanitation and hygiene habits, as well as their situations. And through these reflections, identify the potential risks that they are exposed to through the practice of open defecation. And from there, cause them to further identify and agree collectively on various actions that seek to address these problems.
And now we are also bringing on board a new dimension of WASH in healthcare facilities, which is now being championed by the World Health Organization as the way to go if we want to improve health outcomes at our healthcare facilities. From UNICEF data, we are aware that close to 4,000 children die annually in Ghana as a result of diarrhea. And this is largely a contribution from open defecation. In the Upper East region, for instance, up to about 89% of the population practice open defecation. And when you look at the northern region, about 72% of the inhabitants also practice open defecation. These numbers are overwhelming, and you can attest to the fact that it's as a result of this that we are having up to 4,000 children in Ghana, and the northern region, Upper East region, contributes significantly to this particular number of children that die every year as a result of diarrhea, which is related to open defecation.
Tepat nam la walana. Tepat nam la walala. Tepat nam da engesema. Te dola wala kem pasina lanta ka tenyo tiranya bina samanin la.
Mandanya binye banjra mana saman maso. Ndabo lapti hagolwabran bina zuka kanyir saman ma.
Otida ka bangira karanyir saman alani.
La yelmen ete danyir bina wara te zang la ba ka te diti bin ka ngir ba bergo ka zurken duata ka bin sa gite lanzu la mahkata da ngir bina ba wara
tinya bina yen saga ni la ya lerin tise vatami tingo akwen ka piere ka zan duudi tinambe
la angu tete labu maha la ko yan woni
ka zo hala ni ken labu ka kwena labu di dananga ka tinti ba
kasani una urbina la ke enti ko mapon ka dun kan ba
to wuha nsak itina ngan nyed bina ka pit
jilin sin da tahri jilin simam mu yishila kamu tang yi biane ka labakin shayi kakane kanyela kan ya dotanga to ama yumalo ma kan chinan petishane to gbaji ka juro mbon kamu sabtanya kamar amfani da dambiya
kalenget bangira pongene ka ba wonte zihazi beti ya pongene soma lana ngan songte kate danye dat ti ya pongene.
EcoWash project is implementing community-led total sanitation at the community level, and this was from the backdrop that during the initial implementation of the iShine project, we realized that after providing facilities for school children at the school level, there was a gap in the community, meaning that children have facilities in the school, but when they go home, they don't have toilet facilities at home, which means they go back to the community to practice open defecation. The aim of the EcoWash project is to improve the health and well-being of 152,334 rural adults and children. The project is doing this by implementing the CLTS approach. And then at the school level, we are implementing wash in school. And then at the health facility level, we are implementing the wash care model. In the first year of the project, we supported 30 communities to work towards achieving open defecation free. Out of the 30, 16 communities passed and have been certified open defecation free. Currently, we are working with 94 communities in Talensi district to help them achieve open defecation free. We do this by gathering information from the community and then disseminating the information with them, helping us to know the key areas, the key people who will help us implement the model. And that is done through the pre-triggering phase. Then after we have gathered the information, we set a date with the community, and then we carry out an exercise called triggering, where communities are made to identify issues that affect their sanitation. They come up with action plans, which is aimed at working towards improving those sanitation. After that, we support the communities by providing them with the skills and knowledge of coming up with improved household latrines. We do this by selecting emerging leaders local champions from the triggering session, and we train them. We call them natural leaders, and then we also term them as sanitation advocacy group members. Currently, the project has trained sanitation and advocacy group members for the year 2 implementation with a total number of 460. And we trained 150 in the first year of the project.
Te dohwa nekti ko kormo za wabi da nye binala emboriansi wabi dan pinani tan korani ko sohoni da burini ba me yirka ba me ba ti gbini ida tiranye binani katiranye binani la za wabi da ba ka jilma da ka tetiya so ya gap a wompok dop ka so ugar kanyo o pombo mi ona ensense ama CRS ni aso mengde muntanala da baka ke katafa bangye la lanna bo songtia la nariti tu banjira ka ensi na mo abra ka tukapi ka daen ka tida et lanna za wa bhala pa baka ke ka yela bergo bule pagatia tina enga wala baka ke ka la ken nindagi ni tida zin ti sohpu ni kada ilinye so dama en yildila ka te bonyange te zangai pa tamang pa me kimo enga te zang pa te tengnap ka te tengnap ni te tenga sama en kalbo page ba bakale pa sama dem ka bawo na bang bana ense sil na baka tika tumla kinin dagala kama en kanyibo enge la palier te ponna bo pege.
In this community, initially our people, they were just sitting around simply because we were not having a latrine for that, even though we were not happy with what they were doing, but we also have to just take it that way.
At the school level, we used to record a number of absenteeism, but of late, with the introduction of EcoWash program in the school, the health style of the people have changed. The children are being taught how to wash their hands at critical times of the day. Supposing they go to toilet, they have to wash their hands. They have been educated how to properly wash their hands with soap and water. We have also been given BCC materials, that is behavior change materials, which we use to inculcate or integrate in our teachings. So it has really helped to improve the lifestyle of the children towards health issues.
Open defecation is the act of toileting around without using latrine.
I have learned that open defecation is not good because we will get such diseases like diarrhea, cholera, and other waterborne related diseases.
We must always wash our hands after visiting the toilet and after playing.
We have also benefited from some KVIP's latrines in the school, which we use. some time ago, some of the children, because we did not have these things, they were easing or were freeing themselves around in the open. But with the introduction of this, we have also benefited, and it is helping us in our education.
So now the boys are having their own, and the girls are also having their own, and they are now using it independently.
Lamane lansim lamane yigala ti dawne male guzi ngala titu ngang nyet bangila ba na la ka wala ya ti pa man tim yo le nyet wala basa be yan so nye so kwa ko ponye yan kwa se ki palo guzi bangila be e kenye
tinana tidana nye bin leye amana na tinye toilet me tinganga nye binana me ni en ki zangul yenye binna ba na yina piege nu na fine ala en so mate
ingila bangira la so mlanye yira